So, Dr. Chioma, can you tell us now who are those who should take this vaccine?
Mm.
Because I think many women might be wondering if they should take it now or maybe the age has passed for them to take it. So,
Yeah.
who are those who have to take this vaccine?
Now, the human papilloma virus is vaccine preventable.
Yeah.
So, early vaccination has been seen to reduce the cases of cervical cancer by 90%.
Yeah.
So, now it doesn't mean that when someone takes the vaccine, you don't have to get screened. There are other preventive measures will come
Okay.
to
Mm-hmm.
aside vaccination, but then we encourage you to get vaccinated early and then keep on getting screened routinely.
Okay.
Now, for those who should get vaccinated, from the age of 9 and above, within the school age of 9 to 16,
Yeah.
that's the best time to get vaccinated because it's believed that within this period, I mean, sexual exposure is little to none, little
Mm-hmm.
to zero. Even though we know that teens and adolescents are also sexually active,
Active.
but then
Yeah.
the exposure risk or rate is
It's
low.
reduced.
And the
Yeah.
earlier a girl or boy gets vaccinated, the better, for them. But above 16, you can still get vaccinated. Yes.
Okay.
Now,
Mm-hmm.
depending on the type of vaccine, we have the Gardasil, we have Cervarix. Now, with the Cervarix, I think you can protect up to 26 years. But with the Gardasil, you can get up to 45 years of age, you can be vaccinated. But the thing you have to note is that as you advance in age, the efficacy
Of the
of
vaccine.
the vaccine reduces for
Mm-hmm.
you because you are most likely to have been exposed to the virus. And then, of course, the immune systems are different when
Different.
yeah.
Exactly.
So within 9 to 45, depending on the vaccine, boys and girls can get vaccinated.
Okay.
And this is a very, very key preventive measure because vaccines save lives.
Yeah.
Yeah, they do.
Okay, so with this, so are you trying to tell us that even women who have been sexually active can still take the vaccine?
Yes.
And when you want to take the vaccine, is there any examination to be done where maybe they have to examine the woman and maybe do her any checkup first
Mm.
before she receives the vaccine?
You asked a very vital question. I'd answer it this way. If you are going for vaccination, you
Mm.
don't screening is not required
Okay.
before you receive a vaccination, as long as you're within the age to receive the vaccine.
Okay.
If you've been sexually exposed, and I keep using the word exposed because it's both sexual intercourse and sexual intercourse. So the thing
Yeah.
with HPV, you don't necessarily need to have sexual penetration for HPV to be transmitted. It can also be transmitted during sexual intercourse, like oral sex.
Yeah.
HPV causes a couple of other cancers except cervical cancer. The oropharyngeal or throat cancer
Yeah.
causes vulvovaginal cancer. It causes anal cancer and causes penile cancer. That's cancer of the penis. So oral sex can also lead to HPV transmission. So
Okay.
while condoms are really protective, keep using your condoms because there are other STIs. However, it's not 100% protective for the HPV.
Ooh.
Yeah. So that's why I keep saying sexual contact. So
Yeah.
if you're still saying, "Oh, I've not had any penetration, so I might not be infected," people loosely call it technical virginity. So
Yeah.
if that's the case,
That's a good
no, you're
one.
not protected if you're having oral sex. So yes, that's it
Okay.
basically. If you're sexually exposed, you can still get the vaccine. Just know that you need to keep getting screened. Screening is one of the preventive measures,
Mhm.
so you need to keep getting screened routinely every 3 to 5 years, or depending on what your doctor tells you.
Tells you,
Everybody's
yeah.
case is different. They could tell
Mm-hmm.
you to come back in a year for reasons best known to your
Your
healthcare
healthcare
provider, but
provider.
then averagely every 3 to 5 years you go for the screening,
Mm-hmm.
so that if they find anything early, it can be tackled. That's why we encourage screening because early detection is key
Is
to
key.
survival.
So when do you start this screening? At what age
Yeah,
can someone start doing the screening?
from age 21.
Okay, so from age 21, every woman, if you're out there, you're age 21 and above, and you've not done your screening for cervical cancer, please, please, this is what we are talking about today. Just go and do your
Yeah.
screening such that if there's any problem, you're going to tackle it early and it can be cured, especially if it is identified early. So you said boys and girls too can take the vaccine. So why is it important for boys to take the vaccine?
Okay, I would
Mm-hmm.
say easy math again.
Yeah,
You know, who are they having sex with?
the
The
men.
boys. I mean, why we have different types of sexual
Mm-hmm.
relations right now, but then for the women, um, men have sex with men, men have sex with women. Because
Mm-hmm.
remember, I said there are different other cancers that can be caused by the HPV, anal cancer, throat cancer, anything. So anybody who is having sex is at risk.
Okay.
So the men too can have HPV. They are the ones who transmit it to the women. Do you understand? In
Yeah.
heterosexual relationships, they transmit it to the women. So in when the man is protected, he's also passively, indirectly
Protecting
protecting
the
the woman.
woman.
So we need to get
Exactly.
our boys vaccinated as well as the girls. So it's a collective thing, and it's the same age
Yeah.
bracket.
Okay, I think there's one question which I think might be our audience might ask.
Yeah,
If you have cervical cancer, can you get pregnant?
of course.
Because people might be scared to go and do it. Maybe they say, "Oh, if I discover this, I'm not going to have the children I want to have."
Mm.
And so, what's your advice on that?
Okay, yeah. So there's a popular saying in Africa or in Nigeria where I come from. People say ignorance is bliss. I think it's one of the most ignorant statements.
Yeah.
No pun intended. It's one of the most ignorant statements. And people say that when they want to run away from knowing certain things.
Knowing
Someone will say,
things
why am I going
exactly.
to get screened?
Mm-hmm.
So that I will now, in my place, they'll say, you will find what you're looking for. But
Yeah,
then that's
that's not the
that's really
essence of it.
ignorant. That's not the
Yeah.
essence of it. So I encourage you to go get screened, but here's why you need to get screened. When you get screened, we're checking for certain transformations.
Yeah.
One thing about cervical cancer is because of the location, firstly, the rate of development is not as quick and aggressive as other cancers. It can be localized too.
Mm-hmm.
And when it's found on time at the precancerous stage, like it tells you when something is about to become cancer, or it's like say, take me
Take
out
note.
now. If you
Yeah,
don't take me out, I'll now
exactly.
become cancer. So when we find it at
Okay.
that stage, which is called the precancerous stage, it can be even you can get treated on the spot, with cryotherapy and
Yeah.
other methods that are available now,
Yeah.
thanks to technology. So that can be treated on the spot, and then we make sure that there are no cancer cells anywhere, and that's it. Now, for the other stages of cancer, depending on the stage, the early stages, survival rate is very high. The rate of treatment, is also very high. So, but when it gets to the advanced stage, and maybe you need to have different kinds of forms of intervention, chemotherapy, radiotherapy, we would tell you, your doctor will discuss with you if you still plan on having children.
Yeah.
There are different assisted
Yeah.
reproductive methods
Methods.
now.
Mm-hmm.
So if you want to have children biologically your own, you
Yeah.
can harvest your eggs and
And
freeze.
freeze.
Because
Exactly.
one thing is chemotherapy and radiotherapy, all those things can actually, the other exposure to
Yeah.
radiotherapy can damage, it
Mm-hmm.
attacks all fast growing cells, including the eggs,
Yeah.
the
Yeah.
woman's eggs and the man's sperms in that case. So if anyone is going through cancer therapy, it's a very great question you ask. Anybody going through any cancer therapy, and
Therapy.
you plan on having children,
Mm-hmm.
discuss that with your doctor.
Exactly.
Mention to them that, oh, I plan on having
Having
children. I don't have
children.
children yet, or I want to have more, and I want to have from my own. So they will harvest
The egg.
the
Oh,
egg. Yeah.
yeah.
So they will keep that and freeze for you, so that whenever you're ready, through with that they can do the
Exactly.
IVF or surrogacy or however you want to do it, but then the eggs are safe. So yes, you can have, if it's a precancerous stage, that one is not an issue at all, because there's no exposure to radiotherapy. Once they do the cryotherapy, you go
That's
on
all.
with your, yeah,
Yeah.
that's all. Yeah.
Well, thank you so much, Dr. Zobo.